Hi guys, welcome back to the Doctor's Discoveries. Today we're going to be talking about the lobotomy. I'm Serena.
I'm Sharvi.
I'm Shanti.
And I'm Ellen. Basically, a lobotomy is a surgical procedure performed on the brain. The brain has many lobes with different functions, but the lobotomy mainly focuses on the frontal lobe, which is the part of the brain that gets targeted in a standard lobotomy. Again, lobotomy surgeries consist of making holes in the skulls, removing brain tissues, and severing connections between frontal lobe and the thalamus. The thalamus is an egg-shaped structure in the middle of the brain that is a relay station of all incoming motor, which is movement, and sensory information. This lobotomies were first pioneered by the Portuguese scientist Vegas Moniz in efforts to provide relief to people with mental illnesses unresponsive to standard treatment. It aims to sever nerve fibers between frontal lobe and the thalamus using the methods of brain cannulae, Lobotomies, chemical injection, destructive ultrasonic waves, and etc. Lobotomies are used to treat schizophrenia, affective disturbance, OCD, severe depressive illness, psychosis, and even chronic neurosis. They were first found out when mental asylums were packed with people and there were very few effective treatments.
Yeah, so adding on more about the history, in the 1930s, research was conducted by, like Ellen said, a Portuguese neurologist named Antonio Moniz, and he basically removed the frontal lobes of chimps and took away their anxiety and frustration, and that led scientists to believe that they were experiencing eternal happiness because of the procedure. And so they thought that this would help take away negative disorders like depression, OCD, and bipolar disorder in humans. And they basically, at that time, they thought that these disorders were caused by negative ideas getting fixed in neural fibers of the brain. And so they thought by destroying or severing those fibers, those disorders would be taken away and they would basically experience eternal happiness like the chimps. And they also thought at that time that calm behavior was a sign of recovery, even though it kind of was more like a numbness. And so basically, Antonio Moniz proposed that severing these fibers could eliminate the disorders, and the way they did this was a surgeon could drill into the skull and cut the white matter, which in the brain, which connects the prefrontal cortex to the rest of the brain. So basically, like cutting into the brain and like destroying it in a way. And like Ellen said, many people were institutionalized at this time because of many reasons, like they needed mental help, or even because they didn't conform to the societal norms at that time. Like even people who were gay were believed to be different in a bad way, and they were also subject to these lobotomies. And many of the people weren't able to give informed consent to the surgery, which even added on to another huge part of the controversy. Sharvi, do you want to add something quickly?
Yeah, and also you were saying, since there were so many cases of people who were considered needing psychiatric help, the hospitals were really overwhelmed because lobotomies were really used really popularly. And I think there were around 50,000 procedures, and there were no antipsychotic drugs, so this was the only option.
Yeah, it was a very widely used form of surgery. And basically this man named Walter Freeman developed a new method that was even easier for surgeons to perform, meaning that it happened even more, and it was called the ice pick method. And basically they used an ice pick instrument and pushed it into the bone in the eye socket and used that to manipulate and sever the fibers in the brain. And the reason why this was so popularized was because it could literally be performed by a physician without surgical training in under 10 minutes, which is insane. You didn't even need a formal training. And even Walter Freeman himself was able to perform the surgeries, and he didn't even have a formal training, which just shows how insane it was that this was allowed to happen and how many people were affected by it.
Yeah, and I also want to talk about the science, exactly how it works. So you mentioned, it was like very in the frontal lobe, so like the prefrontal cortex, which manages function, inhibition, planning, personality expression, and like a lot more. But as you can see, like a lot of like emotional and decision making things. So the lobotomies like targeted the connection between the prefrontal cortex and deeper brain structures, like Ellen mentioned, the thalamus. And so the logic at the time, like Shanti mentioned, but by taking out the white matter tracks, it would weaken emotional intensity and also reduce obsessive or paranoid thoughts. But basically, the scientific reality of this is that severing these tracks can reduce cortical integration, which basically means that signals can't properly travel between areas, which are really responsible for high order thinking and just like normal emotional evaluation. So the result would be a like diminished anxiety and agitation, but also a loss of initiative or a lot of apathy. And then like you can't do decision making very well and you're very emotionally blunt. And then also the procedure caused this thing called axonal shearing, which is like cutting massive bundles of fibers that are connected to the PFC, the prefrontal cortex. And then frontal lobe syndrome, which is, like I said, deficits the memory and judgment and emotional modulation. And then the procedures usually took like 10 minutes or less, but just because there were so many people who wanted to do the procedure or were forced to, the hospitals got really busy. And some short-term effects would include immediate confusion or seizures. And despite like crude methodology, a lot of like severely distressed patients actually experience like reduced agitation, but at the cost of like essential human capacities.
Yeah, and just quickly adding on, like Sharvi said, people with depression and schizophrenia were the ones who benefited more than others, but it had a big of a cost.
So adding on to Sharvi with more side effects, like as she said, there was emotional like blunting. So like many of the patients lost the ability to feel strong emotions and they became just like flat and like indifferent. And then people who were like previously vibrant were like they became passive and just like super disconnected. And people had cognitive impairment and memory issues, loss of initiative, reduced social functioning, neurological complications like seizures and stuff. And then like there was also many mortality risks, and early lobotomies carried a meaningful risk of death from infections, hemorrhage, or surgical complications as any other surgery. And there was also a lot of institutional dependence. Do you want to add more to that, Ellen?
Yeah, along with that, some other side effects were bleeding after the operation, brain infections, dementia, and epilepsy.
There were also some ethical concerns that came with these. For example, there was a lack of informed consent, as many patients were not told like fully the risks, and some could not consent at all since they were minors and institutionalized individuals. There was also coercion and abuse. Like many procedures were like used to manage like quote unquote difficult behavior rather than treat like actual medical need. And then there was also like questionable motives. There was also inadequate scientific evidence. There was irreversibility. So like this procedure caused permanent brain damage, but it was also used as a first-line treatment. So that was a little bit questionable. And there was also a lot of conflict with medical ethics and historical misuse as social control, as in some cases the lobotomy was used to suppress behavior as seen as socially undesirable rather than medically harmful.
Iges Moniz also received the Nobel Prize in 1949, which validated the practice of lobotomies, but then later, after the first invention of an antipsychotic drug in the 1954, it offered a non-surgical alternative, and it rapidly replaced lobotomies in hospitals. So now we don't see lobotomies, and today they're considered unethical, non-evidence-based, and like an exploitation of desperate patients.
Thank you so much for listening to this week's episode about lobotomies. I'm Ellen.
I'm Serena.
And I'm Shanti. Just a quick disclaimer, this podcast was entirely researched and produced by high school students, so not everything we say is completely true. Thank you for listening.